Should I make it blue? Let's see, blue. Hello? Why is it not changing? Oh, there. Do we like blue? I'm gonna go with blue. I don't even know how to start a YouTube video anymore. Hi guys, welcome back to my YouTube channel. If you're new to this channel or if you don't even remember who I am, my name is Leila Baleni and thank you so much for clicking on this video. It's been hectic since the last time I saw you guys. It's been quite hectic. As you've seen, I haven't uploaded a video in months, so I've just been focusing on school, and I guess that's kind of why this video is also about my 3rd-year experience. I put a poll on my Instagram asking you guys to ask me questions about 3rd year or even like anything really dentistry related. So I'm gonna answer a few of those questions. Of course, if you liked the video, don't forget to like and subscribe, and let's just get into the video, guys. 3rd year recap, and what have you learned personally going forward? This is a good question. So 3rd year, I need to summarize this in the quickest way possible, right? So from 1st and 2nd year, if you watch my other recap or review videos about my 1st and 2nd year, you'd know that I did 6 modules or 6 courses per year. In 3rd year, we had 13 courses, 13 full year courses. So that was literally like double what I did over the past 2 years. So it was that, plus I still had to do preclinical work, so I still need to do lab work. And they also added an addition of seeing patients, like actual human being people. Yeah, they also added that. So 3rd year was intense. It was overwhelming, you guys. Overwhelming doesn't even begin to explain what we were going through. And worst case, for people who don't know, but Wits dental school has been experiencing some kind of issues that I'm not gonna go into. But essentially, we started our academic year late. So I think I only started my 3rd year in April. So that's like 4 months lost, basically. So I basically had to complete 3rd year within like 8 months. Maybe even less than 8 months. So think of all those factors coming into play. Already 3rd year by itself is hectic because you're still adjusting to, you know, the number of courses that you have to do and seeing patients. But then now adding time restrictions onto that as well. So it was crazy. It was genuinely crazy. So in a sense, recap, it was overwhelming, but what I've learned personally is if you actually like put your mind to it, and if you're actually determined, and if you actually like put in the work, you can actually do it. So I think that's something that I personally learned. Also, dealing with patients, that was a new component in my career, or my academic career rather. I have learned so many people skills, if you will. Like, I've learned how to build good rapport. I've learned how to speak with different individuals, because you know, people are different. So it's things like that that I would say that I personally learned. What was your favorite and worst module in 3rd year, and why? Okay, so I'm gonna start with my favorite one. My favorite one was pharmacology. Oh my days, you guys, that thing is beautiful. It is just, it's gorgeous. It's mwah. It was basically a recap. Since 1st year, I did physiology, I did anatomy. In 2nd year, I did pathology. So pharmacology was just literally just a recap, like, okay, this is how the body works. When you have this disease, you need to take these drugs, and all you had to learn is the drug. What's an easy example that I can make? For example, you have somebody who has high blood pressure. You know that the heart is not supposed to work that way. Therefore, they have high blood pressure. So therefore, you need a drug that's going to counteract that, and it's this drug. Beautiful, simple, straight to the point. I loved it. That was my best module that I ever did in dentistry as a whole. I loved it so much. I would do it again. It was just Then the worst one I would say was definitely oral pathology. Personally, no. It's a no for me, sweetie. Oral pathology was the girly, hey? It's a lot. Like, you learn about a lot of different diseases that manifest in the oral cavity and other tissues associated with it. You had to learn histology, you had to learn radiology, you had to learn pathogenesis. Like, there was just a lot going on, and personally, I just found it boring on top of all of that. And I'm just the type of person where if I find a subject boring, and on top of that it's already difficult, I'm not gonna have the motivation to study it. And even though I really did push myself to try and, you know, just get into it, the first couple of weeks were good. I'm not gonna lie, the first couple of weeks were good, and then after test 1 everything just went downhill from there. So it's a no from me. Advice for students who are about to start 3rd year. My advice would be, take everything that you've learned so far, that's including 1st year, especially anatomy and physiology. Actually everything, let me not just say those ones. Everything you've learned from 1st year, 2nd year, just take it with you and apply it. Because 3rd year I feel like it's more application. You've learned how to do certain procedures in the lab, certain procedures that have to do with resto, certain procedures that have to do with pros, endo. You've learned all these procedures. Only difference now is you're gonna have a real human being in the chair. And I'm gonna be honest with you, it's gonna be very overwhelming because you are juggling 13 courses that you actually have to attend lectures for, study tests for, and still come and give out your best in the clinic. Like, it's gonna be overwhelming, but once you get into the rhythm, then you're gonna be good. I just promise you. Just keep on going, be consistent. It's gonna be hard, it's gonna be overwhelming, but just keep going at it. And don't overthink things. I think one of the problems that myself and maybe even some of my classmates had last year is we were overthinking things. So because you have now a human being in the chair, you're like, I don't know if I trust myself into doing this procedure. And which is fine, because obviously it's your first time working with a real human being, so you don't want to like mess up or anything. But that wastes time as well. So just go into it. Of course, if you really don't know what you're doing, rather just stop and ask the supervisor to help you or to like guide you. But like, you know this, just revise everything that you've done that you've done so far, and just do. Which year was the least hectic? I feel like if you ask people this question, it's gonna get different answers. Least hectic for me was 3rd year, and I'll explain why. 2nd year, definitely not. I'm sorry, 2nd year was the pits. We had oral bio in the mix. It was just, I hated 2nd year. Personally, I just hated it. It was not for me. I feel like if it wasn't for COVID, my answer would have been 1st year as my least hectic year. But because we had COVID, things were kind of like challenging for me personally, especially having to study at home and all those things. Everything was kind of overwhelming, and yeah. So I feel like because of that, automatically I'm gonna say 3rd year. 3rd year was hectic in terms of like the amount of work I had to do and all those things, but in terms of like academically, should I say, it wasn't hectic for me personally speaking. I enjoyed 3rd year, minus the whole time restriction type of thing. 3rd year was really just a breeze for me personally. Again, everyone's gonna have a different answer. What's the hardest thing about dental school? Dental school, there's so many factors that you have to consider when you're a dental student, right? So what most people don't know is, or what most people would think is, as a dental student, you just go in, you study about teeth, you study about how to do certain procedures, and you're good. And some people are genuinely confused about why it takes us 5 years to study something that may be so simple. But what people don't realize is that as a dentist, when you're doing certain procedures, you're extracting teeth, you're drilling into teeth, giving people fillings, doing all these different procedures, you forget that that person, that head or mouth that you're working on, is attached to the rest of the body. So for example, if you're going to extract a tooth in a pregnant lady, for example, or somebody who has like serious bleeding issues, you need to know the implications of that. So you need to have some kind of background knowledge on certain like diseases and health issues, so that you don't put patients at risk. So I think what's hard about dentistry is you can think of it as a combination of studying medicine and dentistry. So the medicine part is where you study about the different diseases and the different health issues that are associated with certain people or certain situations, and how to handle those situations should it be that your patient literally just faints in your chair or has a seizure or has an allergic reaction, how to treat those things, how to prescribe certain medications, when to prescribe, when not to prescribe. And then the dental component comes in where it's more handsy, more like practical components, like certain procedures come in, like how to make veneers, how to bleach teeth, how to give fillings, how to give people false teeth. So it's a combination of the two. I think that's what's the hardest thing about dentistry. Can you bridge oral hygiene to dentistry on the first day of oral hygiene? No, you cannot. No, you cannot. When you want to study dentistry, you have to start from the beginning, like from first year. So you have to apply as like a new applicant into dentistry. More information on the video that I did with Lisa, it'll pop up somewhere here. I'll just link it down in my description box below. But just to answer you quite frankly, no, you cannot. What are the disadvantages of studying dentistry? Also, would you recommend it? Dentistry is a very stressful degree. Like it's so stressful, it's so overwhelming. There's so much pressure being put on you as a student, so much that's expected of you as a student. Yes, you can be book smart or like really like the smartest person ever, but then if you don't have the, how can I say, the motor skills or psychomotor skills, if that's the word that I'm looking for, I don't know. But if you don't have those skills, it's like, what are you doing? Because dentistry is literally just this, like your hands. So if you're not good in this, well, it's gonna take you some time. And like I said, there's a lot that's expected of you. We are learning about so many different disciplines. So remember, dentistry has different specialties. So there's periodontology, there's restorative dentistry, there's prosthodontics, endodontics, orthodontics, maxfac, like the list goes on. So as a dental student over the years, you're going to be learning about those different disciplines, and you're going to be expected to be good or good enough in those different disciplines as a student. There's just a lot going on. You're doing a lot of practicals, you're seeing a lot of patients, and you still have to, come back home, go through your lectures, study. Like, there's just a lot expected of you. I think that's what's difficult about dentistry. But would I recommend it? I think I would recommend it, but only to people who actually have the passion and drive for it. I wouldn't recommend it as like a pass-by type of thing to study when you don't have anything else to study. You need somebody who has passion for it, who has the drive to do it, and somebody who's quite resilient, because it's a very stressful degree, you guys. I'm not gonna downplay this. You can watch all my other videos to just get like an idea of how stressful this place is. And then the last question, how do you stay motivated? Honestly speaking, the only thing that's keeping me motivated is the fact that I wanted to do dentistry to begin with. I feel like if I did not want to do dentistry, I would have probably dropped out by now. But the fact that I've always, not always, but like for the longest time, I've enjoyed dentistry and dental related careers, it's kind of like interesting for me to learn about different techniques and different procedures. So I feel like that's what's driving me to continue on and study. But yeah guys, those are the questions, or some of the questions that I got. I don't want to make this video like an hour long, otherwise yeah. But I'm back. I don't know if I should even say that, but I guess I'm back on YouTube. Stay tuned definitely for more videos. And I'm sorry that I disappeared on you guys. It was just a very hectic year, and yeah, I'm gonna try to be on my best behavior this year. Thank you guys so much for watching this video. Don't forget to follow me on Instagram at Lele_Baleni. I think I'm also back on TikTok. I'm not really sure. We'll see. At Lele Baleni. Everything is all linked down in the description box below. And of course, I'll see you guys in the next one. Bye.